And welcome everyone to this week's Maternity and Midwifery Hour from 7 to 8. This is number 12 of Series 3. My name's Sue Macdonald. I'm the chair of this lovely hour. I'm also the curator for the hour and for the festivals as well. It's my pleasure to be with you this evening. And tonight we're going to do a little bit of reflection on the year that's just gone, as many people are doing this week for obvious reasons. And then we're going to move into one of the themes that has been a kind of constant theme in this year, which is about unconscious bias. And I'm delighted, and absolutely delighted, to introduce Lola Ornato. Have I pronounced that correctly, Lola?
Yes, I mean, I would say Lola. I always tell people my name is Lola, but actually I was thinking today, why don't I actually just pronounce it properly and see if people can have a go? So
Okay.
Ornato is completely correct, but the correct pronunciation of my name is actually Lola.
Lola. Okay,
Yeah.
Lola. Okay, I'll try and remember that. Thank you. Thank you for that, Lola. Okay. So we go, and we're going to include as part of Lola's session a few little revisits to sessions we've had before. So that's going to be really interesting and helpful, I think, for people who might have missed some of the discussion previously. And of course, because Lola's here, I'm going to ask her for her moment of the week, as we always ask all our guests for.
Well, I would say my moment of the week was fairly boring, but actually very satisfying for me. And it was the fact that I was able to have an hour's nap this afternoon while the children are at school. So I found it very enjoyable and I feel very rested now.
Wow. And that's a power nap,
Yeah.
audience. That's a power nap. That's a very good moment of the week. I can see you're refreshed and rejuvenated with that. So that's fantastic. Now, I'm going to do it slightly differently. I usually talk to the audience, but this time I'm going to just share my screen, and hopefully this will work out all right. Okay. Da, 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 da. That's it. Oh, it does work. How wonderful. I usually leave my speakers to be doing this. So I'm just doing a little bit of reflection 1 year on the Maternity and Midwifery Hour. And that's just to show how super we are in terms of having gold medals awarded to our YouTube channel. If those of you, when I'm talking, you'll probably hear about some sessions and you might think, oh, I need to go and find out about that. Have a look at the Matflix channel and you might find, well, you will find lots and lots of information there, lots and lots of resources for you to be able to use. Now, I'm just reminding everybody that this time last year, we were all very excited. It was the year of the nurse, the midwife. We had lots of celebrations planned. It was very fantastic. And then what happened? This old business, the COVID-19 arrived and things were very different. And actually, we had to know that we were going to have a lockdown, which happened this time yesterday, last year. The lockdown happened and we knew we wouldn't be able to present any live face-to-face events. And we really were very keen to provide something for midwives, for student midwives, for doulas, for anyone really working in maternity services, to keep them up to date with lots of information and support in manageable sections rather than a whole day as a conference. At that point, we planned an hour. So there we are. There's the stork bringing the Maternity and Midwifery Hour. So that was our whole purpose behind this. And because Neil Stewart's associates who run these events with Matflix have got a very long experience of online and recorded events, we knew it would work and it would work well for our audience. So that was that, and I'm sure that those of you who watch it will know about this anyway. But these are just some of our speakers. We've had some fantastic speakers over the year, and we've tried to include things that really will help midwives, will help student midwives to cope with COVID and also practicing at this time. And we know that mostly midwives have stayed in maternity services, but they still have been pressured by the events of COVID because people have been off sick, people have been very stressed, they've had to cope with the PPE, they've had to cope with the new language that's come from things like personal protective equipment and masks and everything. So we've included things like student perspectives, new regulations. We've looked at long COVID. We've looked at bereavement. We've looked at infant feeding. We've looked at COVID data and the evidence that's really generated hugely. We've looked at compassionate care. We've looked at sustainability and being eco-aware. Very importantly, we started with looking at well-being and looking after yourself, and we have had that as a theme throughout the year to make sure that people are looking after themselves, because I think one of the difficulties is if you're in the health service and you have a family, you have responsibilities, you're very much balancing everything and working very hard, and we know that midwives have been working very hard, and student midwives and healthcare support workers, everyone in the maternity services. So big thank you to you all just for the time being. We also have had MBRRACE, we've had Chai and Chat with the Assam midwives, we've had lots on the COVID vaccination, and a lot on the maternity services and how they've coped with COVID and providing different levels of care. And, you know, moving on to technology, making sure that women and their babies are looked after, but safe, and have their services continued. And last week we're looking at continuity of care. So there's a lot here. And if you've missed any of these things, they're all recorded, so they're all accessible to you, so you can have a look at them. This is just a wee snapshot of the Maternity and Midwifery Hour. And you can see we've done equality, we've done risk and parents' voices, we've looked at COVID, we've looked at MBRRACE, we've looked at self-care, mental health, and the vaccine. So we've been very busy, and this is one snapshot, and this is another snapshot, all these people. Now just think, some of you out there might be called upon to come and speak at the hour, and we'd love you to do so. So if you have an expertise or you want to share something, there are two ways of doing it. One is to contact Neil Stewart Associates or me, or you can tweet, which is what our speaker today did, and attracted my attention on a subject that needs attention. So there we are. These are all our lovely speakers. I think I've included all of them. And I think what I've found from this last year, it's been a very hard year. And I know there's some people who haven't had very much to do, and there's been a lot of us who've been much busier. And it's been very difficult to balance a different way of life. But what has been really, really encouraging to me and nourishing to my heart as a midwife and as a nurse is how the public have really valued the NHS and the health workers. And they've really come up trumps all the way through. And for me, it's really the strength and the value of that NHS family has really shone out. The teamwork and support has been fabulous. The kindness and compassion. I mean, when you hear people talking about what's happened, a member of their family has been cared for in intensive care, and the staff have gone over the limit to try and make sure that they're cared for and really have an opportunity to interact with their loved one. The kindness and compassion is fabulous. And I think in maternity services, I think the strength, the love and the commitment of the midwives and the maternity service family has also come over really well. And in most cases, women have kind of reported how well they've been looked after. Obviously, they've had difficulties because for a period of time, partners were excluded for obvious reasons. And now that's kind of been ameliorated. It's a lot better. But I think women have felt cared for in the most cases. And I think the other thing that's hit me is the innovation. I think we've achieved more this year than we've probably achieved in the last 10 years in terms of technology. Just look at the Zoom meetings and the Teams meetings now. We're not having to travel around to meetings. We're able to meet much more easily. And that includes being able to see women and be able to give them advice over the Zoom or the Microsoft elements. I still miss the face-to-face, and you'll see at the bottom of my picture, I've got a picture of one of our festivals, and I think that was one of our last face-to-face conferences. And I know that people miss, and midwives especially love to get together and to talk and to be together. And I think that's one of the things we miss. But I think the way we have Zoom meetings, for example, does help. That we've been trying to create ways of making sure we get that communication. I think the continuity and keeping everything going has been fantastic, but it also has been a time of huge learning and a huge challenge to us all. And I think we have to kind of acknowledge that some things have really brought into sharp focus. So what we've learned about looking after ourselves is we are strong, but we also need to recognize when someone needs support. Things like resting when you can. Now, Lola has illustrated brilliantly. She was tired, she had a rest, and that was fine, and that's good. And we need to look after ourselves like that. We need to be kind to ourselves and to our colleagues. We need to recognize when somebody needs just that little bit more support. I noticed on one of the news programs last night, this ICU team, they were looking after each other, and you could see how close they were together, and that was fantastic. And I'd like us at the end of this, if there is a complete end, that one of the things we'll have is that closeness and that teamwork would be fantastic. So it's okay not to be okay. Having a personal strategy for caring yourself, really important. I think we started our sessions with Jenny and Sheena talking about having a personal strategy for caring yourself, like working out as a team. This kind of idea of wobble rooms, buddying with a colleague. I loved Jenny's idea of having a sanctuary box, of having this sort of emergency kit to look after yourselves. And also, of course, thinking about exercise and good nutrition and going a bit easy on the chocolate. I'll say that because I love my chocolate. And for what of the coming year? Well, we're aiming to have a series 4, so look out for that. And we obviously still are running the maternity and midwifery festivals totally online at the moment. We've had some stunning speakers in the past, and we're carrying on with that. We're also looking to find any new topics that you think would be useful to you in practice. And we're quite happy to have a few more clinically things. We will go towards there, because we really want to grow the resources at Matflix for you when you're doing work, for those of you who are students, and for those of you who are midwives who may be looking at revalidation. Loads of resources there, but we always want more, of course. And we just want to say a huge thank you to our NHS staff, to our intensive care units, high dependency units, obviously the maternity units, all the key staff, and that includes everybody from the cleaner to the porter to everybody who keeps the place going in the units. So here's some nice flowers, nice pretty flowers to keep us going. And I also need to thank the team who bring this to you. And that's Karen and Neil Stewart, who run the whole thing, with Catherine Stewart as our technical genius behind the scenes. Dr. Jenny Hall, who some of you will know, who chaired a couple of these days, these hours, and also looks after the Matflix, putting them together with the reflection and reflective tools and everything. And Paul Rushworth and Deborah Murray, who look after the real back room of getting the tweets through to us. It's a lot of work, and they're absolutely fabulous at what they do. So thank you to that team. And I want to thank you all for joining us every Wednesday. Hope you continue to do so. You see, I include all for maternity in the practicing midwife and Matflix, because there's our support at this time as well. So thank you to all of you for joining us, and keep going. Not next Wednesday, though. We're having a little Easter break now. Okay. No, I've just stopped sharing. Okay. So I'm going to just, I don't have much in the way of news this week, funnily enough, because I think the news to me, it feels as though it's been very much focused on reflecting on the year gone, and maybe we'll need to start reflecting on the year to come. So that's our focus for today. Now, just moving on to now, I'm going to introduce with great pleasure. First of all, we're going to have a little video with the speakers who've spoken before, who you may have heard before, and we're just going to play that video now, and then I shall introduce Lola. Lola, to you. I'm trying really hard, Lola. Sorry.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.